Good morning, everyone, and thank you for joining us for our very first installment of Wellness Wednesday. My name is Christy Lau, and I'm a Senior Director at Partners in Care Foundation, which is the sponsor for Wellness Wednesdays. For Wellness Wednesday, the purpose is to provide you with just a short burst of education, of something fun. And so one of the things that we wanted to share with you during the month of September is the fact that September is Fall Prevention Awareness Month. So we dug in the crates, we checked out some of our resources, and we thought of some really great things to share with you this month. Today, I'm so excited to be joined by Dr. Jason Crandall, who is going to share about his program, Bingocize. Dr. Jason Crandall is an associate professor of exercise science and co-director of the Center for Applied Science in Health and Aging at Western Kentucky University. With over $2.5 million in support from the National Institute on Aging, Retirement Research Foundation, and the U.S. Center for Medicare and Medicaid, his research focuses on the development, testing, and dissemination of Bingocize, which is a health promotion program that increases functional performance, health knowledge, cognition, and social engagement in older adults with a variety of physical and cognitive abilities. The program has been implemented in 38 states and 3 foreign countries. He has received numerous awards, including the Western Kentucky University Research Award for Innovation and Impact. Everybody today has been joined in listen-only mode, but that does not mean that you won't have the opportunity to ask Dr. Crandall questions. You have a couple of different options for asking those questions. You may use the chat function, or there is something on your screen called Q&A. You can go ahead and type in those questions there, and at the very end of the presentation, we will address those questions, having Dr. Crandall answer. So without further ado, I am going to turn it over to Dr. Crandall to share about Bingocize.
Thank you very much, Christy. I really appreciate the invitation to be here today, and I appreciate everyone being here to hear a little bit about Bingocize. I'm just going to give you a real taste of what Bingocize is, and then I hope you will follow up with additional questions towards the end of the presentation. So I'm just going to start off by showing a nice video that I think really does a good job of describing what Bingocize is. So we'll start with that.
An example of a steady step stool is a chair. Is this true or false?
Exercise can help prevent chronic diseases and falls in older adults, but unfortunately, less than 15% of older adults exercise regularly. Many older adults report that traditional exercise programs are not enjoyable, leading to inactivity and related health issues. Bingocize offers a unique solution that mixes exercise, health education, and bingo to help overcome health problems in participants across the entire spectrum of care. It's completely adaptable for all types of facilities and is beneficial for all ranges of physical and mental ability. Evidence shows social, cognitive, and physical improvements. And the best part? It's fun. There are 2 ways to play Bingocize: the traditional version and using a mobile app on any electronic device. Both versions are led by trained leaders utilizing the contents of Bingocize in a box. Bingocize is a fun, affordable way to improve health and quality of life. For more information, visit our website at www.bingocize.com.
So hopefully that gave you a really good idea of what Bingocize looks like. And so you notice that there's two really ways to play Bingocize. We can play using what we call the traditional version, where you use your facility's regular bingo game along with our structured curriculum, or we have a mobile app available that you're going to see a little bit of it in just a little bit. But regardless of which version you use or delivery you use, the program is made up of 3 distinct units. Each unit is 10 weeks long, twice a week. And of course, all 3 units include bingo, because we've got to have bingo because that's the fun piece. And the other 2, there's 2 units that have some education built into it. And so regardless of which unit you choose to use, you're going to get exercise and you're going to get bingo. So it's always going to be fun. Of course, we also have it in Spanish version, and we also have it in a Polish version as well, for those of you who would like those versions. Next slide. So I think one of the really great benefits of Bingocize is that we have it available for older adults across the spectrum of care. So whether you live in independent living, whether you're residing still in your home and you're going to a senior center, or you live in an assisted living, or even in long-term care, we have a Bingocize program that fits all of those places. So we've got a lot of opportunities for all types of older adults with all ability levels to actually participate. Next slide. The really great thing about Bingocize also is that it is evidence-based. So we've done a lot of research looking at the effectiveness of Bingocize in all different groups of people. And these are just some of the results that we've had. So of course, a lot of physical improvements. So a lot of improvements in lower body strength, which is going to help reduce falls. We've had increases in executive function, which is a measure of cognition. We've had cardiorespiratory endurance improvements. It's going to make you walk better. And balance, of course, is extremely important. And when we've seen balance improvements. We've also seen improvements in health knowledge. So when we taught older adults about fall prevention, we taught them about nutrition, we found that they had significant improvements in their knowledge at the end of the 10-week program. And finally, we also found improvements in what's called health activation. So older adults' confidence that they could take care of their own health was also improved at the end of the 10-week program. Next slide. So there's lots of components to Bingocize, so we keep it lots of fun. This is just one component that we have. So of course we want older adults to be active even outside of Bingocize sessions. And so we have take-home cards that encourages you to be active and to do things that we're trying to teach you. So this happens to be a fall prevention take-home card. And as you can see, there's exercises that we ask you to do. If you do those, you get to mark off the card. And we ask you to invite more people to the Bingocize session and to go back to your homes, look around, make sure you remove clutter so that way you don't fall. So if you fill out this card, you bring it back to the next Bingocize session, you get a special prize, because of course, prizes are an important part of Bingocize. It is bingo, right? So that keeps it fun and engaging. Next slide. So here we have a lot of different types of people doing Bingocize, and you see that some are using the tablets for the mobile app, and some are actually just using the regular traditional Bingocize game. So we also have equipment that comes along with the Bingocize program so that your facility can have access to that equipment during the program. So we've got resistance bands, we've got therapy balls, and so all of that comes with the program when the facility brings it on board. Next slide. So I mentioned the mobile app, and of course, Bingocize was developed to be done face-to-face, whether using the traditional bingo game or whether using a mobile app where everybody is together face-to-face using some type of a device. You can use a phone, you can use a Kindle, you can use a laptop, whatever kind of device you have. And so that's how it was done. So since COVID, we have really done a lot of work using the mobile app for remote delivery. And so we have a couple of different options for that remote delivery. We can use the mobile app exclusively, where someone is on their end using a device, they log into the app, they can use a video conference platform like Zoom, and they can play along. Or we have what's called a hybrid version, where the facilitator is showing the app, and the people at home are using a paper card instead of having to log on to the app. That makes it a little bit easier on the technology side. Either way works great. I know Partners in Care is actually using the hybrid version right now. And so you do have the opportunity to participate in Bingocize using the hybrid version. So I just want to show you what the mobile app looks like, just to give you a taste of what it is. And so I'm going to share my screen. Okay, so if you logged on to the app, this is exactly what you would see. You would see a bingo card. And you notice this is a little bit different than your normal bingo card, because it's all numbers. And we did that on purpose because we want you to have the incentive to do the exercises and answer the questions throughout the entire game. So I'm just going to go ahead and start the game so you can kind of see how it works. So it's really simple. So in this case, all you have to do is click on 15 on the card, and then the facilitator will continue going. Okay, here's another number, right? Because we got to keep it fun. We got to keep bingo in there. And here's your first health education question. So this is a fall prevention session. So we're talking about hearing loss and how hearing loss can be something that could increase your risk for accidental falls. So you as a participant would just click on the answer you think is correct. There's no penalty for getting it wrong. So everyone would get the correct answer, and then we would discuss it. Once you get the right answer, you can click the number on the card, and then the game continues. All right, so this is the first exercise. And so you see there's a description on the screen of how to do the exercise. And so we have the option of doing it together. So I, as the facilitator, could stand up and take you through it. You could do it with me. We also have the ability to show a video. So I'm going to show you a video. And the video should start. There we go. And you do have the option of turning on the sound if you'd like, so you can hear a description as the exercise is being demonstrated. And then once the demonstration is over, the facilitator can close that video, and then you as the participant can click OK, which tells us that you've done the exercise, and then we click on the number. And so the game continues like that then until at least someone wins, right? You can win diagonal, across, and straight down. And then you would get your prize. And all kinds of prizes can be available. Some facilities will use personal care items. Others will use nutrition focused types of prizes. And then a new game will start. And then we'll continue on through until we can get through the entire session of all the exercises and all of the health education questions. And then of course somebody will win that game, and then the session ends. And everybody has had a great time. Everybody's done some exercise. Everybody's learned some health education information that they could take back and use, and they'll come back to the next session. So hopefully that gives you some idea of what Bingocize is. There's a whole lot more to it than that. But if you have more questions, I would be happy to answer those right now.
Thank you, Dr. Crandall. I see that we have a couple of questions here. So one question says, I know you said this was evidence-based. As a part of the Older Americans Act grants, what tier would Bingocize be under? There are 3 different kinds of Bingocize, correct? One with exercise, one with fall prevention, and others with nutrition and education, right?
Yes. All 3 units will fit under the Title 3D evidence-based tier at the highest level. So it is already approved by the NCOA at the highest level. It's also approved for SNAP Ed, and it qualifies as an obesity prevention program as well.
Great, thank you. See another question come in. How long is each class again?
Good question. Of course, it really depends on the level of experience of the participants, and also if you decide to use the unit that has the health education information, because the whole idea behind the questions is to kind of generate questions and discussion. And so that could go a little bit longer, but on average, you're probably looking at from 45 minutes to an hour, something like that, particularly with the health education units.
Great. Other questions? I encourage you all to join the chat using the chat function or entering your questions in the question and answer tab. See another one come through. Is it just one class?
One class. I'm not sure I understand that question. Each unit is 10 weeks long, twice a week. So it's a total of 20 sessions per unit.
Great. Someone also asks, organizations who are doing this, are they charging for Bingocize?
I have not heard of organizations doing that. I don't think Partners in Care is, so I don't think so. As a whole, I have not heard that.
Thank you. Another question, how many days a week would a person need to participate to achieve the evidence-based effects?
80%. 80% is considered a completer. That is what we consider a completer for our research, and therefore that is what we consider for the evidence-based fidelity of the program.
Someone also says, can we have access to this class? Yes, absolutely. At Partners in Care, we do offer this class, and we have some other partners up and down the state of California who will also be offering Bingocize. So at the end of this presentation today, I will share a little bit more information about how you can gain access to this class. Dr. Crandall, somebody asks, what is the minimum age someone could participate?
There is no minimum age. We of course focus on older adults, but we encourage family members, grandchildren, everyone to actually participate along in Bingocize. We've actually started doing more research with other populations, including kids and young adults and middle-aged adults, all adults, because Bingocize is fun. And we want people to have fun while they're exercising and learning valuable information. So in my opinion, the more the merrier.
Great. Someone also asks, when I use the mobile app, will I be able to be on video with others?
Yes, absolutely. Currently, we do not have live video capability within the app. And so in order to use the app along with the video conferencing platform, that's how it works currently, because we do think it's important that you are able to see other people and to have fun and engage with other people. That's the real draw, I think, to Bingocize, because you're having fun playing bingo and you're able to interact with others.
Great. So someone also asks, so I can join from my home?
Absolutely, you can, yes.
Another question here. With it being Older Americans Act approved, would they not have to be at least 60 years old?
For the evidence base, yes. If the organization is using Title III funding, I'm assuming that they will have to meet that age threshold. The question earlier about minimum age, I don't consider there's a minimal age, but that might be a requirement for that particular funding mechanism. So I think that would be up to the organization. So Christy, I'm not sure how you guys view that.
Yeah, absolutely. So at Partners in Care, we do use Older Americans Act funding to offer Bingocize. So for those classes, we do not turn anybody away, but for those grants, want to make sure that we're only counting those people who are age 60 and over.
Mm-hmm. Mm-hmm.
Another question here. What age range did the evidence-based studies follow?
Well, all of our participants in our research were at least 60 years old, but our average participant were in their early 70s, but we had individuals as old as 96 participate in Bingocize. And I think that's one of the real draws to Bingocize is it's really meant, and I've always considered it more of a step-up program. So it's really meant for those people who aren't physically active right now, which is the vast majority of people. And so it's a fun way to kind of get your feet wet, get started, get active, get moving. Hopefully you'll enjoy it and you'll continue to be active, and then maybe search out some of the other evidence-based programs that are available, like Tai Chi or Zumba or some of the other ones that are available. So I think that's one of the real benefits is it's a wide range of ages that we've used it with. A wide range of disabilities have participated as well. I mentioned earlier that we do have a long-term care program. So that's exclusively really for people in long-term care, people who are wheelchair bound and that are still participating in Bingocize.
Awesome. Another question here. How many prizes could a person win over the course of a class?
That's a great question. Typically, we will get through 2 to 3 games within a session, within a class. So, if you're really lucky, you could win 3. So that's typically how it works in a session. So I would say at the most per class, you could get 3.
And how many people are in a class?
We tried to keep it to 20 or less. But if you've got access to a couple of trained facilitators, then we can go more than 20, but typically we stay below 20.
Great. Another question, can my members use this program using their cell phones?
Absolutely. Yes, they can. Yes. The mobile app we call it a mobile app, but really it's ran over the internet. It's web-based. So as long as you have an internet browser on your phone or your Kindle or your laptop or whatever device you're using, you can go to the website and you can get on, you can log on. So yeah, you could use whatever device you have.
Great. Another question here, how can you become a trained instructor? Is this something you can be trained on via Zoom or is it in person?
Good question. We have an all online training. So, once we've gone through the licensing procedure and all of that good stuff, it's really simple because we will just send you a link. You'll click on that link, you'll register for the training, go through the training. It's all asynchronous, which means you can start taking it, stop, come back. And it only takes probably a couple of hours at the most to go through the training, and then you get a nice certificate at the end, and then you're ready to go.
Great. Someone says, we love this idea. What are some best practices to get started?
Great. Well, Partners in Care has done a fantastic job of really facilitating the remote delivery of this. They have an amazing toolbox kit that I actually share with people all over the country because they've done such a fantastic job of getting this going. So I would say contact Christy and Partners in Care, and they can definitely kind of direct you on best practices for that.
Absolutely. So you may be professionals out there who are interested in offering Bingocize within your organization. You may be somebody who wants to participate in a Bingocize class. We have all of that for you. So happy to share that. Another question here. So how do remote older participants get access to your exercise equipment during the virtual classes?
That has been a struggle. There's no question about it. We've had to really pivot there. I know that some organizations in the country are mailing the equipment. Some are dropping it off at their homes. Others are making it available at a facility like a senior center where they can stop by and pick it up and take it home with them. Others are really getting creative. We offer the stress balls for grip strength exercises that are included in the program. But if they don't have those, they can always use a sock or some other kind of resistance for that. Even without the resistance bands, you can get creative and use some type of resistance at home that you might have. So we've all really had to be more creative in the past few months, but it's working. And so there's a lot of people that are doing this now, and they're having success.
Great. Yeah, we think about things like canned goods and, getting creative around the home. There's a lot of things that we could probably find if we look around.
Absolutely.
Someone says, where do I sign up? We're getting some enthusiasm here. I'm happy
All right,
to share.
that's great.
Happy to share some resources for getting signed up. What certification is required to be a trainer?
There is no certification required. So lay leaders can be trained to do Bingocize. And we've had people from all backgrounds become trainers. So CNAs, activity directors at senior centers. Of course, we've had clinicians like physical therapists and occupational therapists, nursing, social work. But there's really no certification that is required to become a certified Bingocize instructor.
Yeah, that's a wonderful thing about it. So we can spread it, right? Even
spread
faster.
it, yes. Make it easy.
Yeah, love that. I see a question here. Somebody asks how much the training would be. And for that person, I'd encourage you to reach out to Bingocize at wku.edu. As a local resource at Partners in Care, be happy to help, provide any sort of guidance. But Western Kentucky University would be a great resource to contact in order to get information about pricing, about licensing the program, etc. Another question here, and it's a good one. Can I take a class first before getting trained as an instructor?
Yeah, I'm sure you could. Absolutely. I'm sure you could take a Partners in Care class. And if you like what you see, then I'm sure that you could become a trained instructor as part of your organization that you're a part of. So yeah, absolutely.
Yeah, that's been a very popular model for us. We have a number of people who have facilitated in-person programs with us in the past. And now that we've pivoted to doing everything online, it looks a little bit different. So they want to see, what does it look like first before, I jump in and I become an instructor. Someone also asks, is there an update training once trained, or do you have to do X amount of classes in order to keep your certification?
Yeah, the original certification is for 2 years, and then there's a recertification, and you will take the training again. And we do that because we're constantly updating the curriculum. We're constantly updating the exercises. So we've got lots of new, we've got new flyers, we've got new curricula. So we try to keep things fresh. And so after a couple of years, we'll have you retake that so you have access to all the new stuff.
Great questions coming through, and lots of questions. Want to do a final call if anybody didn't have anything that they wanted answered. Of course, you should see here on the screen a website for the Bingocize program. And in order to reach Dr. Crandall, you can email bingocize@wku.edu. Last call for questions. These have been excellent questions. All right, of course, other thoughts, other questions, other comments may come up after today's session, so certainly note this contact information and the website. And I just want to thank Dr. Crandall for joining us here today. This was such an exciting, such a fun way to learn about a fall prevention resource that looks just like something that we would, quote, normally do, right? We are under a new normal these days. So any way that we can just continue to enhance our wellness, enhance our physical activity, and prevent falls, because we sure are spending a lot of time in the home these days. So again, I mentioned for more information about Bingocize or to enroll in a program, you can visit our Partners in Care Foundation website. You see it here, www.picsf.org/online-wellness-programs. And I will leave this here for a bit. Again, contact information for getting in touch with Dr. Crandall is available at bingocize@wku.edu. As we were chatting, I saw a couple of different comments come in. If anyone did not join today, can they join another time or the next session? Yes, absolutely. Absolutely. We are going to be here with Wellness Wednesdays bi-weekly, so twice a month. And September is really a special month. We want to make sure that we're packing in all of those fall prevention resources for you. So I'm going to give you a little preview of what you can expect next Wednesday. So we're not going to be skipping the week this time in September. We're going to be meeting again next Wednesday for fall prevention safety tips from Jennifer Nolte with the Torrance Fire Department. It's going to be September 23rd at 10:30 a.m. Same time as today, same channel. And again, I want to just thank everybody for joining. Again, if you have any questions that come up, just including the contact information for Dr. Crandall, and I will share that again here.
Christy, I will mention that for anyone who would like a demonstration of the Bingocize app, we do that every Tuesday. Two different sessions are available, and all you need to do is just let us know you want to join, and we will schedule you to be in on those demonstrations.
There was a question that came in actually that kind of dovetails on that. Somebody says, is there an audit involved at some time? So I think that this is probably for folks who get trained, right? They want to know, are they audited at some point?
No, not at the moment. No, we are starting to put together more of a fidelity program, and so we will require a videotape session of leading a Bingocize session. If they're leading the Zoom version, that's pretty easy to audit. So we could definitely do that.
Absolutely. That's the beauty of being virtual these days. There are pluses and minuses, right? We can do this here in California, and welcome Dr. Crandall from Kentucky. So thank you all again for joining us today. We will look forward to seeing you all next Wednesday for Wellness Wednesdays. Bye-bye.
Thank you.